Hi, I'm Dr. Sean Blatt. I'm a chiropractor here in Flower Mound, Texas, and I'd like to teach you a little bit about peripheral neuropathy and how you can fix it. If you've got a friend or family member, or if you yourself suffers from peripheral neuropathy, please listen to this video. It might have information that you didn't know about before. Let me introduce my family here in this slide. As you can tell, my kids get their good looks from their mom. So let's talk about how to get lasting relief from pain, numbness, burning, cramping, without drugs or surgery. So if you would like to get 60 to 100% improvement, this is going to be a very important presentation for you. So stick with me for a little bit, and you're going to learn some really good information. Okay, so if you're experiencing any of these following conditions: numbness, burning, tingling, pain in the hands or feet, cramping, cold, hypersensitivity, back pain, then you may have peripheral neuropathy. So after today, you'll understand the truth of standard treatment of peripheral neuropathy, what could be causing your pain, the documented dangers of neuropathy, and methods for creating lasting relief, and just very simple steps you can take to get on the road to feeling better again. So if you're tired of taking medications, you're going to be very interested in these modalities and the treatment that I'll teach you about. So we average 18 new prescriptions a year. That's kind of crazy. How many drugs we take here in the United States. So we're seeing a concerning increase in the number of diabetes cases. So look how much it's gone up since 1958. It's a 1,237% increase since 1958, which is bonkers. Which kind of tells you there's something we're not doing right. There's something's causing this. Heart disease is also on the rise. Neuropathy is on the rise. So this is an important figure to point out, that $3.2 trillion is how much we spend here in the U.S. on healthcare. So it's important to realize that the U.S. consumes 75% of the medications produced in the entire world. That's crazy. The U.S., though, only has a population of the world, 5% of the world population. So you would think that America, having the amount of money we do and the healthcare that we have, that we would rank really high compared to the rest of the world. But we don't. We rank number 69. So the question is now, what's causing this? Why is diabetes skyrocketing, and why do we score so low compared to everyone else? So part of this problem, I think, is that the current medical model does not correct the problem. The doctors just prescribe medicine to reduce the symptoms. So the common culprit when it comes to neuropathy is gabapentin and Lyrica. A lot of the people I see and treat have been taking gabapentin. That's really the only treatment method that medical doctors have to treat peripheral neuropathy. Now gabapentin and Lyrica are both anti-seizure medications, and they slow the brain down, and the brain does not function as quickly as it should. And with taking these drugs, it does not stop the progression of peripheral neuropathy. So Although you might take gabapentin and you might get some results from it. Although a lot of the patients I talk to, they don't get results from gabapentin. But if you do, if it does help you, it's just kind of masking the problem. It's not really fixing it. Your condition will continue to get worse. Another problem is that we spend about $6.8 billion in advertising. That's not good. Other countries, most of the rest of the world doesn't even allow drug companies to advertise on TV. I think us and one other country in the world, there's only two of us that actually allow that. So, treating ourselves worse than our car, that's a big question mark. A lot of people, if your car is damaged, you're gonna take it in for repair. I like the picture of this car because it shows that drugs are just masking the problem. You're not really this trunk is broken. You're not really fixing the trunk by putting a bunch of tape over it. Sometimes that's how I feel about drugs. You're not fixing the issue. You're just kind of masking it. So the pain and the symptoms you have from neuropathy, they're an alarm. Your body's trying to tell you that something's wrong, and we should listen. So, what is peripheral neuropathy? Peripheral neuropathy is damage or disease to the nerve. Now, there's regular neuropathy, which can be the nerve that comes out of the spine and goes down the leg or to the hands. That's neuropathy. But peripheral neuropathy affects the nerves in the hands and the feet. And the neuropathy that affects the back, that's just your regular run-of-the-mill neuropathy. So, chronic disease is becoming more prevalent here in the United States. 8% of the U.S. population, or about 24 million people, are suffering from peripheral neuropathy. So it is becoming one of the most common chronic diseases. Peripheral neuropathy can occur at any age, but is most common among older adults. 30% of diagnoses are linked to diabetes. So 70% of people who have peripheral neuropathy don't even have diabetes. So that's kind of a little misconception that people have, that you can only get peripheral neuropathy if you have diabetes, and that's not true. I've seen a lot of patients that don't have diabetes, but they have peripheral neuropathy. But if you have diabetes, then you might be more susceptible to getting peripheral neuropathy. So what are the 7 most common warning signs of peripheral neuropathy? So we kind of talked about them a little bit before: numbness, burning pain, cramping, a sharp electrical pain, prickling, tingling, balance problems, and falls, and can't sleep from foot pain. The balance problems are a big issue, and that's when it starts to become a lot more advanced. So the top causes of peripheral neuropathy are diabetes, or being pre-diabetic, poor circulation, toxic exposure, chemotherapy being one of them, herniated discs, post-surgery, autoimmune diseases, infections, alcohol abuse, liver, kidney, thyroid conditions, or several medications. There's a lot of side effects from medications that also give people peripheral neuropathy. So 1 out of 3 adults over the age of 65 fall each year. 20 to 30% suffer moderate to severe injuries, and 10% of falls are fatal. So that's why falling is such a big deal. Once your peripheral neuropathy gets severe, it can be fatal, or Um, it can lead to maybe even losing a limb, which we'll talk about a little bit later. Okay, so each year in the United States, there are about 86,000 neuropathy related amputations, one of the most feared complications of neuropathy. Uh, Patients are often hopeless, and they do not is it's not a good prospect to lose one of your limbs. And I get folks that come in all the time, um, that are in walkers and or a cane, so they haven't lost a limb yet, but their mobility is already starting to really malfunction. So this picture was sent to me by a colleague, and he was doing a dinner seminar, which I used to do quite a bit of these. And while he was giving his talk, someone drove through the window, and it was one of the people that were. It was a patient or a person with peripheral neuropathy that instead of pressing on the brake, they pressed on the gas, and the car went right through the window. So you know, that's something that's dangerous as well when you have peripheral neuropathy. It's if you can't feel your feet, it is dangerous to drive, and it makes you feel like you can't go anywhere safely. Okay, so what are your choices? Let's talk about that. Well, you can either do nothing. That's not really an option. You can go to your primary doctor and get drugs to mask the symptoms, or you can get referred to a neurologist, and they'll do nerve testing, or they'll just give you more medications. And usually, when you go to a doctor, they're just going to tell you, "Here's some drugs, and there's nothing else we can do for you." So that I've talked to many folks, and this is, they tell me the same thing. The doctor told me that I'll just have to live with this. But just living with it can lead to further complications because this is a progressive disease. This is not going to go away on its own. Uh, it has to be fixed in order for the symptoms to be resolved. Uh, and so I know I'm not trying to use any kind of like scare tactics, but it's the facts. I mean, not everyone's gonna get so severe to where they're going to need an amputation, but it is a percentage, and it is something that the longer you have peripheral neuropathy, the higher the chance that is. Okay, so after all the doom and gloom, here's the good news. The National Institute of Health says that peripheral nerves have the ability to regenerate as long as the underlying nerve cell has not been killed. Now, when I was in chiropractic school, we were told and taught that there's nothing you can do about peripheral neuropathy. Uh, those nerves are dead and gone, and you're just going to suffer the rest of your life with this. But after I've been in practice 24 years, and after about 6 years into my practice, um, we then learned about these studies that they did that you can in fact regenerate those peripheral nerves. And to regenerate, you've got to increase blood flow, you have to stimulate the nerves, and you have to activate through therapy, and you have to decrease the inflammation. So those are the four things. If you can accomplish those four things, then you can fix you can fix peripheral neuropathy and get it to be, even if you don't 100% reduce it, even if you get to 90% or 80%, that greatly decreases your chance for an amputation, and it greatly increases your quality of life. But most people I see, if they keep doing the treatment that the treatment plan we've set out for them, they get really good results. Okay, so what is the treatment? And how do you increase blood flow? So that's the big question. And here's the answer: laser light therapy. Um, Light therapy was invented by NASA, and it was developed to speed up cell regeneration, and it does that, and it does it really well. Um, there's been lots of studies done with laser. I have a stack of studies in my office that I'm happy to share with anyone. But laser works really, really well as long as you have the right types of laser lights. That's the trick. But treatment with LED reduced pain and sped up healing in humans. This is what the studies show. Cell regeneration is faster, and it increases the blood flow, promotes new blood vessels to grow, which is very important with peripheral neuropathy. And you have a decreased healing time. Now, I use laser in my practice with all kinds of injuries. I don't just use it for peripheral neuropathy. I use it for knees and shoulders and all kinds of other stuff. But it really works well with peripheral neuropathy. Okay, so the second thing that we use is electrical stimulation. So remember that cord, or maybe I didn't show you the cord, but this cord, this is kind of like a broken nerve. So with peripheral neuropathy, when this nerve, the sheath that surrounds the nerve, it gets broken and it short circuits, and that's one of the that's why we get peripheral neuropathy. And electrical stem, it stimulates that nerve, and it helps to stimulate the sheath around the nerve so that the body will then want to repair that nerve. Now you might be thinking, oh yeah, I can just go on Amazon and get a TENS unit. And no, those are completely different things, completely different frequency. But the important thing I want you to realize is that, there's over 2,000 references on light and electrical therapy and how effective they are. So they are 100% effective, and I see it every day in practice, and how well the combination of using electrical stem with light therapy works. Okay, so here's the other thing. This is me using shockwave. Shockwave works amazing. Shockwave is the third thing that I use on most peripheral neuropathy. It stimulates stem cells, which is amazing because people spend like $5,000 a shot to get stem cells in their body. This device stimulates your own body's stem cells, so it's very regenerative, and it works very well. I use shockwave on a lot of conditions in my clinic because it reduces the inflammation, increases the healing, increases blood flow, and patients with other conditions feel an immediate effect from shockwave. Now, with peripheral neuropathy, the effect is not so quick. It does take more sessions with shockwave to start to get those nerves to regenerate properly. But here's a video of what shockwave. Okay, so you might think, okay, why doesn't my doctor know about this? And that's a great question. And I have things. I have my own opinion about that. And now there are a few doctors out here in the Dallas-Fort Worth area. There are a couple clinics that are run by medical doctors that do treat peripheral neuropathy. They mostly use covered Medicare, uh, what Medicare will cover, but Medicare doesn't cover anything other than like drugs and electrical stim. Um, and the and if you use the electrical stim all by itself, it's not gonna work. And so it's I mean I think most medical doctors, if they're not going to get paid for this through insurance, then they're not going to do it because there's not a lot of money in it. So uh, most of this is an out of pocket expense. The insurance companies do not pay for most of the treatment. But it's very much worth your time and money to get this fixed. I mean, if you can imagine sleeping through the night peacefully, waking up with confidence and feeling steady again when you walk, taking trips and enjoying the family, feeling like you're younger. I mean, those are all super important things. And if I had peripheral neuropathy, I would definitely want to fix it just for my family's sake, because I want to be able to spend time with my family, be able to do the kinds of things I want to do with them. Okay. Um, so that's the main reason, for me anyway, why you want to feel better is because of family. All right. So what should you do from here? Who should come see me here at the clinic? And basically, it goes to these seven symptoms. If you have numbness, burning pain, cramping, sharp electrical pain, prickling, tingling, balance problems, can't sleep because of foot pain. If you have any of these symptoms, then you definitely should come in and get checked out. Okay. So your next step is to reserve a spot, get a consultation. We'll perform an evaluation. We'll recommend a treatment plan, and we'll bring uh, and it's best to bring the person closest to you. So whoever that loved one is that you have, bring them with you. It helps you be clear on what the treatment protocols are. Uh, and I will go over a treatment plan for you after I do an evaluation, to let you know, okay, here's what I think. Not everyone gets the same treatment plan. Some people have less need for some of these therapies. I didn't cover all the therapies. I do have more depending on how severe your neuropathy is. Um, but everyone's treatment plan's a little different. But I do have a Facebook promotion. So if you're watching this because of Facebook, great. If not, if you're watching this from my website, that's fine too. The I always, for all my new patients, I always do a $49 evaluation and plan. I even do that with my chiropractic patients. I want people to come in. I want to make it a low price for them to come in and see what they have, see if it's a right fit, see if this is something you want to do. Um, I mean, the kind of services I perform should cost about $249, because the exam I do is pretty thorough, and the history I do is pretty thorough. So you're gonna get looked at and evaluated, and when you walk out of the office, you're gonna know uh, what your problem is, and uh, if there's something I can do to fix it, then I'll let you know, and if it's something I can't fix, I'll let you know as well. Um, if you're not serious about getting better, and you think, oh well, I don't mind living with this for the next 5 or 6 years, then don't come in. This is for people who are ready to fix their condition, and they're serious about fixing it. Um, Unfortunately, I can't. I'd love to just see everybody, but I really want to see the people who need it and who want to get help, and they want to get fixed. All right, so don't wait. Neuropathy is progressive, and it does get worse over time. So go ahead and give the office a call if you've already received a text message from the Facebook promotion or from my website. Just you can call the number on there or text the number. Set up an appointment, and we'll get you looked at and get you evaluated as soon as we can. And I hope to see you soon, and I hope we can fix you up so you can feel better.